COVID-19 coronavirus here in Philadelphia. Any death is tragic, but today it hits close to home. We have seen the first death in our family of city employees. When Dr. Farley talks about people getting sick and people dying from this disease, too often people are only hearing the numbers. But it's not just about the numbers. These are family, friends, loved ones, parents, aunts, uncles, and someone's son or daughter. It's important for each of us to never lose sight of that fact. And this weekend we lost a friend, a colleague, a family member, and a hero. We lost Lieutenant Jimmy Walker of the Philadelphia Police Department's Traffic Division. The pain for Lieutenant Walker's brothers and sisters on the force is compounded by their recent loss of Sergeant James O'Connor, another life that could not be mourned fully due to the restrictions surrounding COVID-19. This is a heartbreaking reminder that the virus is affecting people throughout our community, especially those on the front lines. We are unsure where and how Lieutenant Walker contacted the virus, but we will continue to do all that we can to protect the other men and women serving on the front lines. Our condolences go out to his many loved ones. As we learn more about people catching coronavirus and people dying from it, this should underscore how important it is that everyone who doesn't need to be outside and around other people stay at home. I've said it before and I will say it again. If you do not have to be out for something essential, please stay home. We also want to remind everyone that you can continue to donate PPE for our first responders and healthcare workers at phila.gov/PPE donation. That's phila.gov/PPE donation. This morning I had the opportunity to visit the Leocora Center, where, as you know, we are standing up a temporary hospital space. It is impressive how quickly this has gone from an empty arena to a ready-to-go medical facility. I'd like to thank Fire Commissioner Adam Teal, who oversees our Office of Emergency Management, and all the folks at OEM and the Health Department who have worked tirelessly to get this location up and running. Also, a big thanks to our partners in this, the members of the Pennsylvania Task Force 1, made up of first responders from Philadelphia Fire Department and across the region. We also want to thank our state and federal partners who help supply the basic patient support equipment, such as cots, commodes, walkers, bathing equipment, monitoring equipment, and more. And of course, our heartfelt appreciation, and I mean this from the bottom of my own heart, appreciation to Temple President Richard Englert, Board Chair Mitch Morgan, and the leadership team at the Temple University for stepping up during our time of need. As I said when we first announced this plan, we hope we never have to use this facility. We hope every single bed at the Leocora Center remains untouched. But if the hospitals of this city do end up reaching that critical point where more beds are needed, we will be ready. And now I'm turning this over to our Health Commissioner, Dr. Tom Farley, to further limit the number of people who are here at City Hall. Going forward, we're going to try going forward. Dr. Farley was going to join us from Zoom, but there was some technical difficulty, so he's here today in person, and we hope to work out those technicalities to get us more separate from each other. So, Dr. Farley.
Good afternoon. Just updates on health. We are continuing to see a growth in cases of the coronavirus infection and, unfortunately, in deaths. Our healthcare system is seeing more of these patients, but it is nonetheless available. We have some new CDC recommendations on wearing masks that I'll talk about, and I have some information from a new survey that we've done on Philadelphia residents about our social distancing recommendations. So more details. Today I can announce we have 539 new cases of coronavirus infection reported in Philadelphia residents, bringing us to a total of 3,728. We're posting more details on those cases on our website, breakdown by age group and by gender. We are continuing to see clusters of these infections in congregate settings where people live together. That includes nursing homes and behavioral health units and the city's jail. The city's jail is reporting 4 new cases of infection in inmates, bringing us to a total of 54. And we continue to work closely with the city's jail to try to stem the spread of that cluster in the jail. Unfortunately, we do have 2 new deaths from the coronavirus infection to report today, bringing us to a total of 45. Of those 45, 18 were residents of nursing homes. More detail on their age and race will be put on the website. It's not there now, but it should be put on there by the end of the day today. In addition to those 45 cases, I have to report that there are a number of deaths that are under investigation that may very well be a coronavirus infection. And so we are likely to be seeing an increase in the number of new deaths reported each day. Because deaths lag the increase in the number of cases, we've had a sharp increase in the number of cases in the past 2 to 3 weeks. So we're going to expect increases in deaths in the next couple of weeks as well. With regards to testing for this infection, it still is available through most hospitals across the city by referral. In general, the testing is for people who are healthcare workers with symptoms or people over the age of 50 with symptoms. The drive-through testing site at Citizens Bank Park is open today and for the rest of this week from 1 p.m. to 6 p.m. After this week, though, we will discontinue the testing site at Citizens Bank Park. The last day will be Friday, April 10th. The remaining test kits, supplies, and other materials will be distributed to these other test sites across the city, which can in turn increase their capacity for testing across the city. As I've said before, there are more than 20 sites where people can be tested across the greater Philadelphia area. Just for example, Penn Medicine has a site in West Philadelphia. Temple University has 2 sites in North Philadelphia. I would suggest if you're interested in getting tested, just go to the websites of those health systems and look for information about how to get tested, and you can speak to someone who can give you a referral for testing at those sites. In addition, the health department is operating a site in Center City. It's open 7 days a week. That also is by referral, and if you're interested in being tested there, call 267-491-5870. Now, our hospitals continue to see an increase in cases of this infection, but there is still plenty of room at the hospitals for patient care. Today, there were 495 patients with this infection in city hospitals, and a total of 887 in hospitals throughout the Philadelphia region. Nonetheless, 40% of the general medical beds in the region are still open, and their emergency departments are seeing about half of their normal volume, so there's plenty of availability for medical care for people who need it. In case in the future the hospitals need more staff to take care of these patients, we're reminding people that we are seeking volunteers that have medical expertise who might work in those facilities or in the city's facility. So if you are a doctor or a nurse practitioner or a physician assistant and are interested in volunteering, go to www.phila.gov/MRC, that's /MRC for Medical Reserve Corps, and put in your information, and if you're needed, we will contact you. Let me just emphasize again what we all need to do to stay safe and protect the medical care system so that it's available when we need it. If it's not essential for work, stay home. If you do have to go out, for example, you have to go to the grocery store, keep your distance from people up to 6 feet, and when you're around people, wear a mask. Now, we've been delivering these messages every day here for a long time now. So we did a survey last week of how well Philadelphians were following those recommendations. We found that 68% said that they were following them very closely, and 25% somewhat closely, or 93% who said very or somewhat closely. Overall, they reported 59% fewer close contacts with other people than they did at times before this infection came on the scene. That's consistent with data that Google has now circulated from its Google Analytics unit on mobility, which shows that Philadelphians are down about 57% in how frequently they're traveling for retail and recreation. That's good, but in some cities and other places, it's down more than 60%. So I would say if the question is how well are we following the recommendations in Philadelphia, I'd give the city a good B+. We're doing pretty well, but we could do better. And if we do better, that'll help reduce the spread of this infection. Related to that, there is new CDC guidance on using face masks. And I want to just read the wording so everybody has it exactly right. It says CDC recommends wearing cloth mask coverings in public settings where other social distancing measures are difficult to maintain, for example, grocery stores and pharmacies, especially in areas of significant community transmission, and that certainly includes Philadelphia right now. Now, the primary benefit for these masks is protecting the people around you. My mask protects you, your mask protects me. So it's an act of courtesy to be wearing a mask when you do have to go out of your home, for example, to the grocery store or the pharmacy, and you can't avoid being around other people. For more information about the overall epidemic, www.phila.gov/COVID, or phone number 1-800-722 7112. Thanks.
Mensaje del alcalde Jim Kenney para el lunes 6 de abril del 2020. Todos los días durante estas sesiones informativas hemos anunciado el número de personas que han fallecido debido al coronavirus COVID-19 aquí en Filadelfia. Cualquier muerte es trágica, pero hoy la muerte nos golpea de cerca. Con mucha tristeza anunciamos la primera muerte en nuestra familia de trabajadores de la ciudad de Filadelfia. Este fin de semana perdimos a un amigo, a un colega, un miembro de la familia, un héroe. Perdimos al teniente Jimmy Walker de la División de Tráfico del Departamento de Policía de Filadelfia. El dolor en nuestro Departamento de Policía de Filadelfia se hace aún más grande por la reciente pérdida del cabo James O'Connor, cuya vida no pudo ser debidamente celebrada debido a las restricciones que rodean al COVID-19. Este es un desgarrador recordatorio de que este virus está afectando a las personas en toda nuestra comunidad, especialmente a los que están en la primera línea de defensa. No estamos seguros de dónde y cómo el teniente Walker contrajo el virus, pero continuaremos haciendo todo lo posible para proteger a todos los que están enfrentando esta pandemia y cuidándonos todos los días. Lo hemos dicho anteriormente y lo volvemos a repetir. Si no tiene que salir a hacer algo esencial, por favor, quédese en casa. Esta mañana realizamos una visita al Diacourse Center, donde se establecerá un hospital temporal. Y es impresionante ver lo rápido que han cambiado estas instalaciones y podemos decir ahora que ya está listo para usarse como un espacio médico. Queremos agradecer por esto al comisionado de bomberos Adam Teal, que supervisa nuestra oficina de manejo de emergencias, y a todo su personal, y también al Departamento de Salud, que ha estado trabajando incansablemente para poner en funcionamiento este centro. También extiendo nuestra gratitud a nuestros aliados en este esfuerzo, los miembros del Task Force Once de Pensilvania, compuesta por el personal de primera respuesta del Departamento de Bomberos de Filadelfia y de toda la región. También queremos agradecer a nuestros aliados estatales y federales que ayudaron a suministrar el equipo básico como camas, equipos de monitoreo, baños y mucho más. Y por supuesto, nuestro más sincero agradecimiento al presidente de la Universidad de Temple, Richard Englert, y al presidente de la Junta, Mitch Morgan, y a los líderes de la universidad por su apoyo en estos momentos tan difíciles. Esperemos que nunca tengamos que usar este espacio. Nosotros esperamos que todas las camas del Diacourse Center permanezcan intactas. Pero si los hospitales de Filadelfia llegaran a un punto crítico en el que necesitan más camas, entonces estaremos listos. La actualización con respecto a la salud para el día 6 de abril del año 2020. Hay un crecimiento continuo en los casos y la tendencia es que sigan aumentando rápidamente. El sistema de atención médica está disponible para todas las personas que lo necesiten, independientemente de su estatus migratorio, el idioma que hablen o si tienen seguro médico o no. Este virus no discrimina por raza o por género. Desde ayer se han confirmado 539 nuevos casos de coronavirus en Filadelfia. Actualmente tenemos un total de 3.728 casos confirmados en la ciudad. Hay 54 casos confirmados entre los reclusos. Se está trabajando para contener el virus en los lugares de alta concentración de personas, como por ejemplo las cárceles y los refugios para las personas sin hogar. Reportamos también 2 nuevos fallecimientos en Filadelfia, donde ha habido 45 personas en total que han muerto por la COVID-19. 18 de estas 45 muertes han ocurrido en hogares de ancianos. Respecto al centro de pruebas del Citizens Bank Park, las pruebas en este centro se administrarán solo hasta el día viernes 10 de abril a las 6 de la tarde. Este cambio permitirá redistribuir los insumos de pruebas restantes a los sitios de pruebas bajo techo, de forma que nos permita expandir su capacidad operativa. Cualquier equipo de protección personal le será asignado a los hospitales y otras instituciones sanitarias. El centro de pruebas de la ciudad en Center City continuará atendiendo a las personas mayores de 50 años, a los trabajadores sanitarios que presenten síntomas del COVID-19. Si cumple con esas condiciones, llame al 267-491-5870 para hacer una cita. Recuerde que debe ser referido por su médico primario o médico de cabecera. Los hospitales se están preparando para el aumento de los casos. El número de pacientes hospitalizados con COVID-19 es de un total de 495 en Filadelfia y 887 en la región, y este número va en aumento. En Filadelfia hay más de 20 centros de prueba. Por favor, consulte el sitio web phila.gov/COVID-19, pestaña FAQ, para ubicar el más cercano a su hogar. Los casos van a seguir creciendo. Por favor, si no es usted un empleado esencial, quédese en casa. Si debe salir a trabajar, le recomendamos mantener la distancia social de 6 pies y lavarse las manos. En una encuesta reciente, el 68% de los encuestados afirmó estar cumpliendo fielmente con la orden de estar en casa. Otro 25% señaló que la estaban atacando de alguna manera. En general, se han reducido en un 59% los contactos directos o cercanos entre las personas. Esta es una calificación de B+. Muchas personas están respetando la orden, pero muchas más deben hacerlo mejor. El Centro para el Control y la Prevención de Enfermedades, CDC, recomienda usar máscaras de tela en lugares públicos donde es difícil mantener las medidas de distanciamiento social, especialmente en áreas de posible contagio comunitario, por ejemplo, los supermercados y las farmacias. Recuerde que la máscara lo protege a usted. La suya me protege a mí, por lo que es muy importante mantener el distanciamiento social. Le invitamos a consultar el sitio web para mayor información, www.fila.gov/COVID. Recuerde usted que puede llamar al 311 si tiene preguntas con respecto al COVID-19. Hay servicios de traducción disponible en 100 idiomas. Si tiene preguntas de carácter médico, puede llamar las 24 horas, los 7 días por semana al 1-800-722-7112. Y esta llamada es gratuita. Mantengamos la fe, juntos remontaremos esta tormenta. Gracias.
Thank you, Armando. And now we're going to move to the Q&A portion for members of the media. Remember that we have limited time for these briefings, so we are asking for only one representative per media outlet to ask questions. And please limit your questions to 3 or fewer. And if time permits, we will have a second round of questions. For those logged in, raise your hands. I see most of you already have. And we will unmute you one by one to answer your questions. First up is Jeff Cole of Fox 29.
Yeah, good afternoon. I have a question first for the mayor. Mayor, in that you do not know how Lieutenant Walker contracted the coronavirus that apparently has taken his life, are you and Commissioner Outlaw planning any changes in how the department, its members are interacting with the public?
We're going to continue to follow medical advice, CDC, our health department's advice on how we handle all of our employees. So at this point in time, we do not plan any major changes, but as we move forward and get additional advice from various medical sources, we will adjust.
Mayor, second question. Today, restaurant inspectors for the city of Philadelphia were called into work, and at least according to union representation, they were told there would be masks of some kind for them. There were no masks when they got there, we are told, and their union representative has told them to go home. We understand the same issue has occurred for DHS workers. They too have not been given masks. Why wouldn't there be some form of mask for city workers who are interacting with the public in light of the CDC's recommendation and in light of what Dr. Farley just said about the importance of that?
This is new information to me, and unless I think Brian may have something else for you.
Thanks, Jeff. We've been rapidly purchasing additional personal protective equipment for our staff. Guidance is going out today for that staff, and we should have fabric masks available for our staff, certainly, if not later today, tomorrow. But we also share those same concerns. I wasn't aware that the union had told them to go home. I'm also not aware of the communications from the departments, so I won't characterize that. But we certainly understand the concerns and are working to address and resolve them.
Why weren't there masks available today, considering the recommendation was Friday, Brian?
Jeff, if you could find 10,000 masks for me over the weekend, I'd appreciate it.
Yeah, I'm just not in that business.
That's my point, Jeff, is we are doing our best to provide all the personal protective equipment we can possibly can. We've also asked our employees if they have their own masks at home to provide them. We're certainly going to do everything we can to provide the equipment necessary for our staff. But as you know, there's a PPE shortage across this country and across this region. And if I could wave a magic wand, I certainly would, but I can't.
But you don't expect city employees to go out without masks, correct?
No, sir, I don't, and that's why we do expect to be able to provide those masks certainly by tomorrow.
Real quickly.
Jeff, you're at 4 already. Go ahead. One quick question.
Real quickly for Dr. Farley, does he agree with the representation that this week is likely to represent America's Pearl Harbor or 9/11 incident in terms of the number of deaths in the country, and does that equate to the city of Philadelphia and the region?
Well, I can certainly say that the number of cases and the number of deaths are likely to rise this week, but I don't think anybody can predict when it's going to top out. So I don't think we should be believing for certain that this is going to top out within a week and it's going to get better after that. I hope that's true, but there's a lot of uncertainty around this. I would simply say it's getting worse. We're going to watch it closely. We've got a good plan in place, and when things start to get better, we'll make sure everybody knows that.
Great. Thank you, Jeff. Next, Annie McCormick of 6ABC. Annie, are you there? Let me try this one more time. Annie, are you there?
Hi, can you hear me?
Yep.
Yeah, can you hear me? Okay. I have a question for you about the 13th and Walnut site. If someone's infected, will they receive treatment there? And how and where is food being delivered? And also, how much is the city paying for the use of the space? I consider this one question, by the way.
I'll let Mike decide if that's one question or not. But on the site itself, the way this entire process will work, for better explanation and context, should a hospital find someone that should be quarantined or isolated that doesn't have anywhere to do that, they will phone the health department to make sure that they concur, and then work with our Office of Emergency Management to transfer that individual from the hospital to the site itself. Likewise, any shelters who are working with the unsheltered population, should they have someone that is exhibiting symptoms or has been tested, they'll work with a clinical diagnosis from one of our federally qualified health centers. They will call the same reference line for the health department, and then they will be referred to the site and be transported as well. There will be food provided on site, delivered to each individual's room directly. And on cost, I'll have to get back to you on that. We do have a cost. I don't have it off the top of my head. I think I covered all those.
Okay. Yes. Second question is about meals. We've been getting a lot of calls from viewers saying that a number of the meal sites are running out rather quickly. I'm wondering if you're trying to kind of just gauge what the demand is as you go along. And also today, Catholic Services began setting up sites also to help. So are you calling on other services like Catholic Services to pitch in, or is that something that people are just kind of doing on their own?
So we always expected that our food sites and our food distribution would supplement existing services, and that there are going to be existing new services that were needed. I think we were successful in standing up, 80 sites for youth, and then an additional 40 general food distribution sites very quickly. But we recognize that they're not perfect. We're going to continue to make shifts in operations and continue to try and make sure we find ways to meet the need, which is just tremendous at this point. So we're going to continue to adjust our operations as we go forward.
And one last thing, if I could, this is more of a clarification. This is for Dr. Farley. When you're saying that you're calling on volunteers, and you mentioned the Medical Reserve Corps and people should reach out, what is the level of need right now? And there's so many different jobs within healthcare. Is there a specific type of job that you're finding that you have too many people calling out for or not enough of? Like, who are you really in need of?
So right now, there is adequate workforce and adequate capacity to treat anybody in existing hospitals across the city. Right now, we're fine. But we're thinking if this gets much worse, we want to make sure we are fine. And so that's why we had the call for the Medical Reserve Corps, which could work in existing hospitals or could work at the temporary facility that we're setting up in North Philadelphia. As far as specific specialties that are in particular need, it's doctors, nurse practitioners, and physician's assistants.
All right, thank you, Andy. Next up is Mitch Blocker of NBC 10.
Thank you. Can you tell us how many police officers are currently in quarantine?
Mitch, we're not going to confirm how many officers or city staff have been either tested positive or are in quarantine. But I will say that our deployment levels remain consistent, and our sick leave usage remains approximately the same as it did in early March.
Why aren't all police officers wearing masks right now?
Again, we've talked through a number of our concerns with personal protective equipment. The protocols that have been put forward by the Commissioner Outlaw have matched what her colleagues have done across the country, which is trying to limit risk for officers and for the public alike, and certainly N95 masks have been distributed to all officers so that they can wear them in those situations that they feel that it's appropriate, and have been asked to call in additional resources should they feel like their public health is threatened.
And one more question, Brian. What is the contingency plan if a significant number of police get this virus or have to quarantine?
You know, we have a number of mutual aid agreements with our departments across the state. You know, I think right now we are planning for that contingency, but we're a very long way away. It's one of the reasons you saw Commissioner Outlaw very early put officers that would normally be off street and put them back on the street and in patrol, and to be able to elevate our levels of deployment and preparedness.
All right, thank you, Mitch. Next up, we have Joe Holden of CBS 3.
Hi, Brian. This is probably for you. If you could just explain the logic in not divulging the numbers of quarantined officers as well as firefighters, just given what we see in New York as well. They detail their rates almost daily. What's the city's logic for not divulging those numbers?
You know, I think we've seen in New York a certain level of elevating those numbers to raise concerns, and I think we are certainly feel comfortable with our deployment levels and the number of officers and firefighters that are on the street, and we'll continue to comment on our sick leave usage, but we don't see any real benefit to divulging exactly how many officers or firefighters were infected or why or how many are quarantined unless it impacts our call levels, which it hasn't at this point.
Brian, still another question for you, please. With the number of potential for quarantine, as Mitch mentioned, a contingency, we're also hearing that the traffic division is particularly hard hit right now. Can you confirm that?
Well, certainly Lieutenant Walker was from the traffic division. We're not going to comment on any specific division within the department, but again, we are comfortable with our officer level at this point, and feel like all the core services and our calls are being met.
And finally, could you give a top-down explanation of the operations at 13th and Walnut, how that works? Just give us an understanding of the A to Z on that facility.
Sure, and as I just commented, I think to an earlier question, hospitals or shelters that find someone who has symptoms or has tested positive for the virus, they will, with a medical diagnosis, make a phone call to the health department. The health department will confirm that it's an appropriate location for individuals to be located. That individual will be transported to the site. And then the site does have wraparound social services and will provide food to the individual in their room. I feel like it has taken us a little bit more time than we wanted to stand this site up, but I got to tell you, the amount of work that has gone into standing a site that can provide social services and physical health and food has been pretty impressive to watch stand up in a relatively short period of time.
Thanks, Joe. And next up is Pat Loeb of KYW.
Hi, Dr. Farley said the city's working with the jails on prevention. Could you explain some of what that entails?
Certainly. So our jails have taken a number of steps to stop the spread of the virus in the jails. Some of that has been including providing masks to all inmates and correctional officers, limiting movement so individuals have access to showers and phone calls, but no other additional mass movement. Food and medication are brought to the cells directly, and we're also in consultation with other jurisdictions about what they have done to slow the spread of the disease.
And is testing in the jails the same criteria so that we can assume that all 54 of those positive cases are inmates over 50?
Any inmate that is showing symptoms is being tested.
Okay. And my first, why is the Citizens Bank testing site closing?
Citizens Bank.
The Citizens Bank Park site was put together through a partnership between the local government, the state government, and the federal government. And the federal government has sites like this all over the region, and for all I know, all over the country. And the federal government is ending its participation as of Friday. And so we could have continued that site. We felt that actually it was better to use the assets we had and distribute them across the many other sites in the city of Philadelphia so that access is distributed. We think we can continue to have good access and not have it be concentrated in that one site.
Thank you, Pat. Next up is Sean Walsh of the Inquirer.
Thanks very much. Could you, Brian, could you talk about the 500,000 masks that were supposed to be delivered from Europe and that deal fell apart? How important to the city's plan was that shipment?
It was one option that we were pursuing for personal protective equipment. We're now pursuing multiple other options. So it certainly would be nice to have it in hand. We don't, and so we are aggressively looking at other sourcing options.
What country did it get stalled in, and is there any more information as to why it didn't happen?
Last I heard, it got. Honestly, I don't know where it got stalled. I was told it was somewhere in Europe. We had ordered them through a known retailer, and for whatever reason, the mask just couldn't come through. And I don't know if that was an overpromise by the retailer or they got stuck in customs at some point. I just don't have that information. And in the end, it's one option of many options that we have pursued that haven't come to fruition. So we're gonna continue to aggressively look.
Thanks. For Dr. Farley, how many ICU cases are there, people in ICU with coronavirus in the city, and how many available ICU beds are there in the city?
We haven't tracked that information because I'm not entirely sure the data we have is complete and reliable. I'll see if it is reliable, and if so, I'll report it out.
Thanks.
All right, thank you, Sean. Martin Pratt is next up with Philly YBN. Martin, are you there? Martin? All right, let's try it. Next, Jack Tomzik of Metro.
Brian, for the mayor. The administration, how does the administration feel the court system is doing in facilitating the release of inmates? I know that the district attorney and public defender's office have said it's moving too slow.
Well, obviously this is an unprecedented situation. Mayors don't have the ability to release prisoners at their will. There's a process that's been put in place. Their petitions are being reviewed, and people that are eligible for release will be released. This is not something we can do to just open the doors and let people out. We need a judge who put that person in there in the first place to remove that person or allow that person to leave. We think it's going in an adequate pace. And I understand the district attorney and public defender's position, but we're going as fast as humanly possible. I believe there's over 60 or so petitions have been filed, and they're going to get to them in good order. It's all we can do is there's 3 branches of government, and this is one of them.
And this is for Dr. Farley. As far as the inmates go.
Jack, I just want to provide a little bit of clarity around the mayor's statement. We actually have had several hundred petitions filed for release, and to respond to that, the courts have opened up in a number of additional courtrooms this week, and are moving much more aggressively than they had previously, and certainly appreciate the court's leadership on that. But just wanted to quickly clarify on that before turning it over to Dr. Farley.
Right. And thank you, Brian. As far as the inmates at the jail, have any of them had to be hospitalized, and have any of them succumbed to the virus?
I was actually just notified prior to this press conference that we've had 1 inmate that has been hospitalized, but no deaths.
Okay, thank you.
All right, thank you, Jack. Let's try again with Martin Pratt of Philly YBN.
Yes, thank you. Just an update before my question. West Philly food site this morning, about 200 people showed up and everyone got served. And I believe they may have had 1 or 2 boxes left over. So thank you guys. And the city seems to be doing pretty good in West Philly with the food giveaway.
Thank you for accurate reporting, Martin. Appreciate it.
You're welcome. And I want to stick to one question. The city of Detroit has done, it seems like an interesting program where they're offering to pick up residents and take them to a testing site. If they are experiencing financial difficulty, they are not charged $2, but if they can afford $2, they pay $2, and they're taken back. I'm wondering, are we thinking of opening up testing sites to all of the residents, whether you're sick or have symptoms or not?
So testing sites are available all across the city, and people can walk up for those testing sites. They are free of charge for everyone. You don't need to pay at any of these sites. Our recommendations are not to test people who don't have symptoms. If you don't have symptoms, it's likely going to be negative, and it may be a false sense of security because you may have been exposed the day before. And we do have limited supplies, and so we don't want to be wasting tests on people who really don't need it. But everyone who needs a test in the city of Philadelphia should be able to get it. We have some 20-odd sites across the city. And again, nobody has to pay, and we have sites where people can just walk up.
Thank you.
Thank you, Martin. And next up is Michaela Winberg of Billy Penn.
Hey, everyone. Can you hear me?
Yes.
Awesome. I have a couple questions, mostly about testing sites. I know the South Philadelphia site, Dr. Farley, you said closed because the federal government pulled out. Do any other testing sites in the city require federal government participation like that to keep running? Like, could the Center City testing site close if they pull out from there?
No, the Center City testing site is being done entirely with city resources, and the other sites are being done primarily with the resources of the hospital systems, sometimes with some support from the city. So the federal government's pulling out will not have any impact on any other site.
Okay. Can you explain how you guys are going to make up for the South Philly testing site closing? I know that one prioritized healthcare workers and people 55 and older. You know, will that fall somewhere else now?
Again, I want to stress that site was one of more than 20 sites across the Philadelphia region. So there's plenty of other testing. The site probably tested 10% or less of all the tests that are being done in the city of Philadelphia right now. So there's lots of opportunity elsewhere. The criteria for who is to be tested is similar across the different sites, but it varies somewhat. In general, it's healthcare workers first, because those are the greatest risk, and because you don't want to be cared for by a healthcare worker who may be carrying the infection. And then as people who have the infection who are maybe more likely to have a severe infection. So that's why we have the age over 50.
Got it. And I know the South Philly testing site had to close a few times because of wind or rain, inclement weather. Are any other testing sites impacted by weather?
I don't believe so. I think the other sites are either in a building or right next to a building, so they're not as vulnerable as that white site was in the open parking lot. I should point out the South Philadelphia site tested the fewest number of people yesterday, so that it appears that the demand of that site is sort of going down over time, I think because availability exists elsewhere.
Got it. Thank you.
Thanks, Michaela. Next up is Michael D'Onofrio of the Tribune.
Hello, everybody. Can you tell me more about Lieutenant James Walker? I mean, how old was he? How long was he on the force? And when did he die? Was it Sunday, Monday, Saturday?
So Lieutenant Walker was 59, and he had 33 years on the force. I was notified of his passing last night, and I believe my notification was fairly soon after he passed.
And just to be sure too, on that topic too, was he like actively, he was on the traffic division, you said, but was he like actively patrolling? Was he out in the public, or was he on desk duty? Like, where was he during the last few weeks?
I don't have the information, all that information, or when the last time he was at work was, but we feel fairly confident with the measures that the commissioner put in place, that those measures both protect our officers, but also the general public.
All right. And then in terms of the number of residents being tested, do you have a breakdown of the race of those being tested? Like, are you seeing equal access to testing among different racial groups, high and low income residents, and so on?
The data we have comes from the laboratory test report, and race is missing on those reports more than 85% of the time. So we have very limited access to data quantitatively on race. I did report a week or so ago when we do a follow-up case investigation, the racial breakdown of the people who were positive there, well, you can get the data if you're interested in that. But most of our race data is missing.
Right.
I guess, I'm sorry, let me just take the opportunity to again point out, though, the virus doesn't discriminate. This affects every racial group, and so everyone should consider themselves to be at risk and follow our recommendations.
And then I might have missed this in the beginning, but the Leah Kora Center up at Temple, has the city decided exactly what type of patients will go there? Are these COVID-19 or coronavirus patients? Is it going to take hospital overflow of people with other medical issues?
Yeah, so the plan there is for it to treat patients who have the coronavirus infection, who are not so severely ill that they need to be in a general acute care hospital. So typically that would be somebody who has been hospitalized at a regular hospital, but then is not quite ready to go home. But this could be sort of a step-down unit for them during the few days when they don't need to be in an acute hospital, but they can't go home.
All right, thank you, Michael. And next up is Brian Mendoza of Telemundo. Brian?
Buenas tardes. Buenas tardes. La primera pregunta es...
Brian, we're not able to understand you. I don't know if you can get closer to your microphone. You want to try it one more time?
Can you hear me now?
Armando, are you able to understand Brian?
Not really, but...
Okay. All right, Brian, we're going to have to try to come back to you.
I do have some of the questions that he has, so if you want to, I can repeat them. Brian, given the death of Lieutenant Walker, is there any changes for the police department regarding the interaction between officers and the public?
At this time, there's no additional changes in protocols, but we will continue to monitor the situation and make changes if and when that's appropriate.
En estos momentos no estamos contemplando hacer cambios en los protocolos, pero estamos monitoreando la situación y haremos los cambios de ser necesario. Gracias. La siguiente pregunta es, officers are not currently wearing masks. Why? Los oficiales de policía no están utilizando las mascarillas por ahora, ¿y por qué?
As we've noted, there is a shortage of personal protective equipment. The protocols we have put in place is to make sure that officers, one, keep their distance where appropriate, two, put on their PPE if and when it's necessary, and three, to call in specialized units if necessary and they fear for their public safety.
Debido a la falta de equipo de protección personal en estos momentos, no hay un protocolo que les obligue a utilizar las mascarillas. Tenemos las directrices de mantener la distancia necesaria, utilizar su equipo de protección personal y en el caso de un riesgo obvio de llamar a las unidades especializadas para tratar con esto. La tercera pregunta es si hay algún plan de contingencia, si el número de personas infectadas sigue aumentando, si es que van a tener que ser hospitalizadas o van a tener que pasar su cuarentena y aislamiento en casa. The question is if there's any plan if the numbers of infected people continue to rise, will they have to be hospitalized or will they have to spend their isolation time at home?
The decision about whether someone should be hospitalized really depends on their clinical condition. Most people with this illness have a mild or moderate infection and don't need to be hospitalized. If people have a severe infection, then they would need to be hospitalized for their condition, not for quarantine. Now, if they are at home, we want them to adopt procedures so that they don't pass the infection on to the people in their household. But again, the hospitalization is really not for infection control procedures, it's for managing their condition if they need it.
La decisión de hospitalizar a alguien depende de su condición clínica, que en este caso resulta ser moderada en la mayoría de los casos, en cuyo caso no es necesario hospitalizar al paciente. En casos severos, sí, se les hospitalizará. Para aquellos que queden en casa, para que no pasen la infección a otras personas, se les da un criterio de aislamiento total en casa, pero si no están con la infección activa, entonces pueden permanecer en su casa durante el periodo de aislamiento. Gracias.
Armando, did you cover all of Brian's questions? I believe you did.
I believe so.
Okay, and next up is Perla Lara of Impacto. Perla, are you there? Perla? All right, let's try coming back to her. We'll go to a second round with Mitch Blocker of NBC 10.
Yes, will Lieutenant Walker be treated as a line of duty death?
We are currently in the process of understanding the circumstances that led to Lieutenant Walker becoming ill, and we'll certainly take appropriate measures if and when that becomes clear. And I think as we look at all of our employees and our city staff, how that infection takes place does matter, and we are in the process of being able to understand those protocols in a more concrete way, and can certainly talk about it in a future instance.
Thank you. I have one other question. Over the weekend, President Trump met with league commissioners from across the sports world, and there were reports that he believed the NFL could return in September and we could have fans in the stands by August. I'm curious, Mr. Mayor, will the Eagles, from what you know, will the Eagles fans be able to see Eagles games at the link in person as early as September?
I have no idea, and it's in the scope of things we're dealing with. It's not in the top 10. Hopefully, this will get back to normal, and life will get back to normal, or what we used to remember normal being. And we want to make sure that fans are safe, and that players are safe, and the officials are safe. But I have no idea what's going to happen going forward. Hopefully, over the next 2-3 weeks, we'll get a clearer picture of what's going on.
Thank you, sir. Thank you all.
Next is Sean. We'll go back to Sean Walsh of the Inquirer.
Thanks very much. On the Citizens Bank Park site closing, that's news to me. Is that a new announcement that that's closing? And what is the last day it will be open?
Yes, as we said earlier, it's closing as of Friday. It'll be open through Friday. That'll be its last day. This is one of many federally supported sites around the country that is shutting down, but the availability of testing is still widespread across the city, more than 20 sites that'll be available.
Thanks. And lastly, either Brian or the mayor, could you update us on the efforts by the administration to get the other unions besides the FOP to agree to one-year contract extensions?
By all signals, things are progressing well, and I think we are close to agreements. We're not quite there yet, but hopefully in the next day or two, we'll have signed agreements with the remainder of our workforce.
Okay, thank you.
And in that regard, I'd like to commend Deputy Mayor Rich Laser and his staff for all their hard work in putting this together in a relatively short fashion. And I think it's in everyone's best interest to have at least a stable year going forward.
Thanks very much.
You good, Sean?
Yes.
Okay. We'll go back to Martin Pratt of YBN Philly.
Can you update us as to when it happens? Can you let us know? when the cleanup starts at the schools that have the lead and asbestos that you're planning to start? And also, Brian, do you have the numbers yet of how many people have been reached through the texting service that you guys been doing?
So I did update that number last week. I don't remember what it was now, but we can certainly make sure that you get that directly, Martin. And as far as the work on asbestos and lead in the schools, I believe that work has started, but I will confirm that and make sure that Mike or Dina get back to you directly.
Okay, thank you.
All right, Martin, thank you. And Brian Mendoza has his hand raised up Telemundo. We're going to try it one more time and see if your sound is working. Brian, are you there?
Yes, I'm here. Can you hear me?
Barely. It's probably not going to work.
Armando has my question, though.
Armando, did you get new questions from Brian?
No, unfortunately, not this one.
Okay, Brian, he did answer the questions you had sent earlier. We are going to move on. Jack Tomzik of Metro.
Just a quick clarification with Lieutenant Walker. Was he one of the 2 additional fatalities that was reported today, or as has been reported, did he pass away in Montgomery County?
Honestly, I'm not sure if that was one of the 2 that was reported in Philadelphia today. He did pass away in Montgomery County, but I believe he was a Philadelphia resident. If that was incorrect, we'll certainly re-clarify in the future, but I believe he was a Philadelphia resident.
Okay, thank you.
And let's go again now to Perla Lara of Impacto. Perla, are you there?
Sí, disculpen, ¿me escuchan?
Good, thank you. Go ahead.
Okay. Sí, la pregunta es sobre, hemos visto otras ciudades como Chicago, en donde desde la misma alcaldía están tratando de ayudar a hacer un fondo para indocumentados, porque sabemos que, bueno, hay ayudas para los hijos y demás, pero hay también muchas personas que no tienen hijos, que no van a la escuela y que no están accediendo a ningún tipo de ayuda porque tampoco son empresarios o no tienen tampoco un negocio pues de alimentos o restaurantes, etcétera. Entonces, ¿hay alguna iniciativa en la ciudad que sepan que esté tratando de ayudar a esta gente o crear este fondo? Son $700 que les va a dar la ciudad de Chicago a todos los que hayan pagado sus impuestos, por ejemplo.
Te repito tu pregunta. Tú estás diciendo si en vista del ejemplo de otras ciudades como Chicago, donde se ha dado fondos por $700 a quienes hayan pagado impuestos, si existe un plan aquí en la ciudad para tener un fondo para los ciudadanos indocumentados que no tienen hijos, que no asisten a la escuela, que no tienen negocios, para poder ayudarles a ellos. ¿Es esa la pregunta?
Correcto.
En un momento. In view of the example of other cities such as Chicago that's providing a $700 bonus out of a fund for undocumented citizens in residents in the city, does Philadelphia contemplate creating another fund for helping these people, especially those who have no children, that do not attend school and don't have any business therefore cannot benefit from it?
We've decided from the very beginning to help fund the nonprofits that interact with our immigrant community. We believe that's the most effective way to do that because those folks are already providing services to that community, but there's been no conversation about the city providing straight out checks to people. I don't think it's within our capacity to do that. Again, we have a couple funds that are funding these organizations that deal directly with these particular groups of folks and know their needs, and we're going to move in that direction unless something else happens.
Ok, ¿podrían después decirnos cuáles son estas organizaciones no profit que muchas veces no están conectadas con este grupo, con esta población?
Permíteme interpretar primero la respuesta y luego hacemos tu contrapregunta. Hay asociaciones sin ánimo de lucro que estamos apoyando, que están sirviendo a las necesidades de la comunidad inmigrante, proporcionándoles servicios, pero en estos momentos no estamos teniendo conversaciones para poder emitirles cheques directamente, porque no está dentro de nuestras capacidades, pero sí estamos apoyando a fondos de un par de fuentes para poder proporcionar apoyo a aquellos que están siendo afectados por el COVID-19 y les dirigimos que vayan por ello. ¿Tu seguimiento a la pregunta era?
que si nos pueden proporcionar cuáles son estas organizaciones que están apoyando o por las cuales se están sirviendo para llegar a esta población, porque no siempre estas organizaciones realmente están conectadas con esta población.
Bien, un momento. Can you provide us the names of these organizations that are providing services to the community? Because sometimes they don't.
Yeah, we can, I don't have it on me, I wasn't expecting the question, but we can get it to you.
No tengo los nombres conmigo en este momento, no esperaba esta pregunta, pero luego puedo proporcionárselo.
Gracias.
All right. Thank you, Perla.
You're welcome.
And I see no other questions, so we are going to end today's daily briefing. We will continue these tomorrow at 1 p.m. Thank you.